The debate is continuing in Washington. Some resistance, as you may know, to what some call socialized medicine. Like they say, systems in Canada and France and Great Britain. But could it work? Joining us in the MSNBC newsroom, Catherine Zaleski. She's a senior editor for Huffington Post. And you recently wrote about an experience that you had in Europe with their system of medicine. What happened?
I mean, it was amazing. I thought I was going to have to pay a huge amount of money, and I basically walked into a national health office because I couldn't handle it anymore. And I met with the doctor immediately. We sat together for 30 minutes. He gave me a prescription. I walked downstairs, and I didn't have to pay a cent. And when I wrote about this, other people contributed their stories as well.
I gotta tell you, though, I mean, just hearing that briefest of stories, people here would say, why should I pay for a foreigner, a tourist, to go in and get health care?
Right. I know, but if I had waited even longer, then they probably would have had to pay for emergency care. So, I mean, this is the kind of situation where I got great preventative care up front.
So you're with family. You explain in this story that you have a migraine headache and you didn't have the prescriptions that you normally use to treat them. What did your family say about the way the healthcare system works in Great Britain for them?
Well, I mean, they said that you go to your first line of defense and you pay nothing for it. And then if you need a specialist, you go get an appointment with a specialist and you get treatment for that. I mean, oftentimes there are criticisms about the British healthcare system and not getting great specialized or having to wait for specialized medicine. I tell a story about how my great uncle was basically turned away from open heart surgery, had to come back the following week. But the end of the story was that he actually got the open heart surgery and didn't have to pay a cent, unlike families in America who worry constantly about medical deaths.
Well, that's another part, is that in the United States, a lot of people worry about the part he didn't have to pay a cent. In the movie Sicko by Michael Moore, he goes to Tony Benn, who was a former member of Parliament, reading the Declaration of the Health System. I want to play that.
It will provide you with all medical, dental, and nursing care. Everyone, rich or poor, man, woman, or child, can use it or any part of it. There are no charges except for a few special items. There is no insurance qualification, but it is not a charity. You are paying for it mainly as taxpayers, and it will relieve your money worries in times of illness.
So basically, he's saying you are paying for it. You're just paying for it in your taxes rather than in a check that you write out to your doctor or to a hospital. The thing is, then you're going back to the government deciding what's best for you in terms of the way you spend your money. What's your sense on that? I mean, could that work here?
Well, I mean, the legislation that's being pushed through right now is finding ways to pay for much more universal health care, as is the case in England. And it's going to actually lower the cost of health care, and it's going to make insurance companies much more competitive. And so I think it's a good thing. It's giving people many more options. And I mean, it's putting more competition into the stream. I will say, you know, the English system, my grandmother actually worked for Tony Benn, and my grandparents left England in the 60s because specialized medicine really wasn't getting enough resources, and they came to America to do that. So, you know, we do have to keep up the level of competition that we have in this country in terms of specialization. But when it comes to basic care and just going to get basic treatment, not having to pay for prescriptions, that stops people from having to get specialized care later on, that's something that England is way beyond.
Catherine, great to have you in. Thanks for sharing your story.